Avenue Development specializes in senior housing, post-acute healthcare, active adult, and really what we're talking about today is our niche focus on primary care and healthcare development and the four things when you're looking at the feasibility of a project that we don't want to forget. The last couple years has definitely showed us that the location and site of care is changing, and the way reimbursement models are keeping up with the changing physical environment in care delivery. So when you're looking at a project, this is actually a way that you can save money on a budget and understanding your operations of what percentage of your patients you'll see now through a virtual model and what percentage will be coming in person to a physical environment. And that will dictate your space needs and probably save some money on a budget versus several years ago when more patients were coming in person. It's really critical to have a development team that understands these changing operational needs in healthcare and how care is being delivered. And we can help you design the space most efficiently to maximize the budget. So not only is healthcare moving in different physical or virtual environments of how care is delivered, but we're really focused on that whole person, holistic health, and looking at the phrase that we all hear a lot of, social determinants of health. So there could be lots of multi-specialty practices in a primary care environment that didn't exist before. And we want to look at, given the patient population that our providers are serving, what are the other needs that they have besides your specific specialty that will take care of that whole person? The Avenue team really helps our partners assess how they can be a one-stop shop under one roof for the social determinants of health and determining, besides our client-specific business, what other specialties and providers that we can add to bring a holistic approach to a patient's health all under one roof. Once we determine what that business model is for our partners, we can also then focus on what that next phase is for patient health and wellness. That word is everywhere right now, but a really big focus that is a crossover in what we do in our senior living and active adult world with what's happening in the healthcare sector as well is really a focus on preventive medicine. And this is really important when you are assessing a new location, a new project, because you can have different providers in preventative wellness that are not traditional healthcare. So think of that as we can help design areas for meditation, for mental health, for massage, for physical therapist. Things that are not typical in a primary care clinic can now be coming into that space that is a continuance of holistic health, getting into prevention and keeping people healthier longer. This is what Avenue is doing with our active adult brand, Viva Bene. We're combining the socialization aspects of a residential community with that forward-thinking preventative health that is coming into the healthcare sector. And so we're adding Sevi Health as a healthcare partner into the community of Viva Bene. The fourth component to touch on a healthcare project feasibility front would be what you want your operational model to be for the long term. And as we move from a world that is based in fee-for-service medicine and getting into a value-based care world, that's extremely important in how we determine site selection in our project feasibility. You need to have an understanding of what your patient base is going to be going forward, and that density of your specific patient panel in a given geographic area will determine how successful that you are going to be in a value-based care world as you move from a fee-for-service. It takes a development partner that truly understands the nuances of your specific healthcare operational model and what is happening in the future of healthcare. At Avenue Development, we have the expertise to help you plan for your next project, not only to be successful today, but in the years ahead as the healthcare field changes.